right. First, thank you to the other presenters. Really great work. I'm excited to talk afterwards. My name is Leah, and although I am an SFU PhD student, I do want to say I'm from Ajax, Ontario, which is just outside Toronto, on the Mississaugas of the Credit First Nation land. I'm also not technically a member or a trainee here, but I'm excited to share my work with everyone. And I hope that you gain something, whether that's knowledge or maybe empathy or a little bit of both or something entirely different. So today we're talking about caring for older people living with HIV in the Fraser Health region. So just a bit of an overview. We're going to do an introduction, literature and missing gaps, my questions and objectives. This is still in the early stage, by the way. We're still recruiting, so I don't have any major findings yet, but hopefully soon. Methodology and analysis, and then why it all actually matters. All right, so HIV is a virus that weakens the immune system, which can actually lead to AIDS, which is a disease. And often we refer to people living with HIV as having HIV/AIDS when written, and that's just to allow for fluidity between terms and different identities. But what's really shocking right now is in Canada, half of all people living with HIV are over 50 years old. So that's a big number, and 1 in 5 new HIV infections are also amongst that same age group of older people. So we're seeing that people with HIV are living longer, which is great, but unfortunately it means new challenges as they're actually entering long-term care and assisted living communities. So with these stats in mind, we're going to go through the future work and understanding why now is the vital time to actually support them. So when we talk about the literature on this, we can't remove ourselves from geography. I'm a geography student, so I'm collaborating with the Fraser Health Authority on this work, which is BC's largest regional health authority. And they've found that over the next decade, they're going to see an increase in people living with HIV entering their long-term care and assisted living communities. We're also seeing that people are moving from Metro Vancouver outside of it towards the Fraser region in search of more affordable housing. So that's a big issue as well. So our literature is showing that they understand that there is this increase, but there is a lack of direct consideration or consultation with these people, older people living with HIV, in the communities that they actually intend to live in, which is long-term care. We're also talking a bit about stigma surrounding HIV, playing a really important role in care. So it can hinder access to care as well as work to isolate these people once they actually get to these care environments. And stigma goes way beyond HIV as a status or an identity, and it goes towards, how they contracted HIV, whether that's their gender identity, sexual orientation, immigrant status, race, income, you name it. So it goes well beyond just the stigma towards HIV as a status. So again, while this literature is showing that there's this growing trend and there's these challenges, we're not actually talking with the most important stakeholders, which is older people actually living with it. So for my questions, I have 2 main ones. Where are the opportunities for strengthening care? And the second being, what barriers actually exist at that intersection between HIV status and aging? I have 4 objectives, which are the first one being interviewing 6 stakeholder communities, and then creating a visual synthesis in collaboration with graphic artists. That is not me. We're going to be hiring someone for that. Engaging meaningfully with community collaborators at every step throughout the research process, and then determining future research questions because this is exploratory work. So here are our 6 stakeholder groups. So we have physicians, administration, care providers, residents, that's current residents, older people living with HIV in the Fraser Health region, as well as community organization leaders. And already our preliminary findings have really focused on administration, so admin at the care environment level. And what we're finding is that stigma is a significant obstacle to them providing what we call person-centered care. Person-centered care is a healthcare approach that looks at treating the resident or the patient directly based on their values, their ethics, their unique preferences, experiences, and then using that to actually make informed decisions about their care and their care processes. So we're seeing stigma having a really big effect on that. Care staff is also emphasizing the need for basic HIV education amongst their nursing staff, as well as additional workshops around stigma. Additionally, discussions regarding residents' HIV status as a crucial part of their identity is really lacking. So when we talk about person-centered approaches, we might talk about income, gender, race, but we neglect HIV status itself as more than just a diagnosis and actually a part of identity. So as far as this research goes, exploring methodology and analysis, our number one thing is collaboration. And from that, we have a community-based approach as well as a resident-oriented framework. And both of those are really built on trust. And without trust, we can't have these four bottom things that we're stemming from, which is co-creation and communication, working with community, as well as partners and expert knowledge. When I talk about partners, I'm speaking about community partners and stakeholders. When I talk about experts, I don't necessarily mean academics or scholars. I mean the people living with HIV as experts in their own care. So why is this significant? Why is this important? We're seeing this increase, we're seeing this trend amongst the demographic itself. We're understanding that older people with HIV have comorbidities, so it's a constellation of multiple factors that change the way they might need to be cared for once they enter long-term care. We're already hearing that people are underscoring this urgency. We're hearing it from community, from peer navigators, from other knowledge users, that right now is the time to act. It's also a key population under the Pan-Canadian STIBI framework for action. We're also looking to provide better access to care, better care provision, reduce stigma, and create a capacity for better research co-creation. This work also spans communities. So I'm at SFU, I'm collaborating with Fraser Health, here with some UBC students. So it really does truly have a diverse landscape. We have tangible recommendations for policy and practice. That's a major goal that we have coming out of this research, because we think that would have the most profound effect on those experts, those people living with HIV. And then finally, we have calls for long-term care and assisted living to be a home. So this is to say that we believe that long-term care has an opportunity to be a caring, safe, accessible, welcoming space. We're hearing people say that they want this to be a true home for them, but we must ask residents, of course, what they value first. What does a home look like? And we must be prepared to listen to them. Thank you.